Hearing will come to order. Welcome all to the first House budget hearing of the 112th Congress. Before we get started, I want to thank Ranking Minority Member Chris Van Hollen for his cooperation in getting this committee rules adopted and with this hearing, and for starting a little early so we can get a head start on the day. Why is this the Budget Committee's first hearing, and why is it focused on health care? Well, let's just put it very simply. Our fiscal problem is a health care problem. Healthcare spending is driving the explosive growth in our spending and our debt. The new healthcare law was sold under the guise of fiscal responsibility. The claim was that the government would spend trillions of dollars, add millions to a new government-controlled healthcare program, and create 2 new open-ended healthcare entitlements, all in order to lighten our budgetary burden. Most Americans understand that something is just not adding up here. Today's hearing is intended to peel back the layers of the law and its maze of mandates, dictates, controls, tax hikes, and subsidies. Many try to distort our criticism of the healthcare law and say that we are criticizing the CBO. Actually, quite the opposite is true. I think CBO does a very good job. We ask them to do a lot under short notice, and they perform very admirably. The analysis performed by the CBO, Mr. Foster, and others enable us to unpack the law's budgetary smoke and mirrors and reveal its true fiscal impact. We face a choice of 2 futures, and nowhere is this choice more clearly defined as it is in healthcare. Down one path lies the managed decline of a government-run system on the verge of bankruptcy. There is an alternative path, and it's a path that leads to true choice and competition in healthcare. It is modeled after the healthcare system that we ourselves in Congress enjoy, and it puts patients first, with providers competing for our business. But before we can get there, we must reject the notion that a centrally planned, bureaucratically run healthcare system can produce more favorable outcomes than the one managed by doctors and patients. Do we want a system that is command and controlled, price controlled, formulaically controlled by government, or do we want a system where the patient is the center, where the patient is sovereign, where they get to decide, where providers, doctors, hospitals, insurers compete against each other for our business, or do we want them competing for favoritism from a shrinking pool of government resources? While I'm opposed to the President's healthcare law, I want to find solutions to these problems. That's why I've worked with other Democrats to come up with other proposals to try and find answers to these. Alice Rivlin and I most recently teamed up on a proposal in the Fiscal Commission. She and I don't see eye to eye on everything, but we try to come together with a compromise to try and find a way to fix some of these problems to address our healthcare problems and our fiscal problems. I hope we can continue to build bipartisan support for policies that create incentives in our healthcare system to enhance quality, reduce costs, and promote patient satisfaction. It's an honor to welcome our first witness, Rick Foster, Chief Actuary for the Centers of Medicare and Medicaid Services. Time and again, Rick's unbiased actuarial reports have proved difficult to square with the claims made by the law's proponents, specifically with respect to the direction of healthcare spending as a result of this law. After Rick's testimony, we will hear from a panel of 3 witnesses. Dennis Smith, the newly confirmed Secretary of Health Services in my home state of Wisconsin. Dennis has tremendous experience in this area, having served as Medicaid Director at HHS under the previous administration. He will give us a sense of what the impact of the law is on the states. Next, Jim Capretta, former Associate and Director at the Office of Management and Budget. Few in my mind have made as compelling a case as Jim on both the costly consequences of this law and the path forward to advance real reform. And we'll hear from Paul Vandewater from the Center for Budget and Policy Priorities. Paul has an impressive background, and I welcome his thoughts to advance an informed debate on this critical issue. I look forward to today's discussion. I thank our witnesses for joining us and for starting a little early. And with that, I'd like to yield to Ranking Member Van Hollen for an opening statement.